Welcome back to the podcast. Today we have Bill Shoemaker on. Bill, thank you for coming on.
Thanks for having me.
Yeah. So what was interesting, I don't think I fully understood your role as what you do, which is what we're going to get into. And it says on LinkedIn, employee benefits practice leader. What does that actually mean?
So what that means is I have the OPCO responsibility for the Central Pennsylvania and West Virginia offices. So two different regions, three offices in each region, and I have full financial responsibility for new business retention and the overall growth of those two offices.
Okay. So you work for USI, and we've
Mm-hmm.
switched over to you guys last year. And I think one of the things that really sold me on USI was a conversation with you and how passionate you are about employee benefits, which we're going to get into because it's one of the subjects that I know I hate. And I'm sure, and not in the sense of I hate it because I don't want them. I hate it because it's just a yucky subject in a lot of spaces, and you brought in a lot
Right.
of light to it. So, to me, I want to focus on today. I want to help people understand employee benefits a bit better and really your take on it and how it can be improved in companies and how I think a lot of companies that are ignorant to those improvements. So, does that sound like a plan?
Absolutely. Absolutely.
Okay.
Sounds great.
Under 2 minutes, what is your career elevator pitch? What is your career in an under 2 minutes? Like, what does that look like?
So my pitch is very different. Again, I see myself as a consultant. Again, I don't push products, so I don't come in saying, "Hey, you need I want to put you in this box." So, we really try to come in and understand what are your business issues. All right, SWF, what are your challenges? What's your vision for employee benefits and how can we get you there? So our big thing is we have what's called a 5-3-4. So we start with the three. We use our three data tools that we have access to, and we attack the four components of your health plan. And we basically disassemble them, price them independently, put them back together. The savings that we come up with, that money can be redistributed back into your company to be used for, the key business issues that are important to you and your people. So we really try to keep it at that consulting level. And then what happens is, the product or the end carrier that we bring is the after effect, not what we're leading with.
Yeah, and that's a huge difference, which we're going to dig into some of that even more because I think that was a big selling point for me is like I
Mm-hmm.
wanted to get out of the box. You came with those answers and say you should want to get out of the box, and I didn't know what that looked like or what was possible, but I think that a lot of the explanation and what you all do was extremely helpful. So the other thing you have a passion for is exposing hidden profits and also a bit of industry reform, which I want to get into, but you want to touch on kind of the hidden profits and some of the things people, overarching people may not understand with healthcare benefits.
Sure. So again, it's, historically because the cost wasn't what it is today, it was easy to just put your business with a carrier. Everything was embedded with that carrier. They kind of managed the whole thing for us. We paid a premium. Everybody was happy, and we just kind of moved on. But, as healthcare prices skyrocket, pharmacy expenses are up, you know, we can't do that anymore. So,
Mm.
again, we have to find other ways to find some margin, and we have to do something with these plans that's a little bit more outside of the box. So, again, you know, everybody in the healthcare ecosystem has their own business proposition. It's not just the health insurance carriers. If you're self-insured, there's stop loss vendors involved. There's administrators that pay the claims, that do the customer service. There are networks that you bring to the table that provide the discount on your claims. And of course, the pharmacy benefits manager that you bring in. So it goes back to those four components of your health plan. There's profit in each one of those components.
Ooh.
And when we trust the carrier to bundle that together for us, and say, hey, we got it. You know, again, everybody's in this, to make a profit, and and that's fine. But if you really want to get into the weeds, you really have to attack each component independently. And again, pharmacy is the low hanging fruit. We find that an embedded plan typically has 30% margin built into the pharmacy claims that,
30.
we can, on average,
30 on
sometimes
average.
more. And again, it's our job to go in there, kind of shine the light in the cracks of your plan and say, hey, here's a few areas of improvement, whether it's redefining definitions, terms, whether we're going to get the rebates that pass back through to the company, whatever it is that we're going to do, there's a way to, get a little bit more transparency by, carving one or all of those pieces out, and, having you contract with them directly as a company, as opposed to relying on the carrier to put all those pieces together behind the scenes. Again, it's not a knock on anybody. It's just, hey, unless you don't explore it, you're gonna get the embedded packaged, product that looks really easy on the surface, but again, can be costly if you ignore the components.
Do you feel that, because I know I was this way until I wasn't this way, do you feel this is one sector of businesses that a lot of people just want to set and forget, which is why they don't dig into this kind of stuff?
I do. I think again, it's very complicated. So you've got multiple moving pieces coming together. It's very confusing. Nobody really truly understands it. I mean, I've been doing it 30 years and still don't know everything. So we're always learning. So to expect a business owner to be a professional in healthcare and understand all those moving parts, I mean, that's not realistic. So I think it's very easy to just what we call park it. You park it, set it and forget it. And problem with that is, you're not doing anything to control cost. Typically 85% of your spend is your claims, medical and pharmacy. And when we do this annual shopping process, we're really just, addressing the 15%. And it's
Mm,
kind of like, you're missing the big picture there. So at some point you have to address, your claims. Easier said than done. But
sure.
again, we're in the world of data now. We've got the tools and the resources and the data to, you know, start looking at things at a clinical level and extracting some of that knowledge to, let the data drive our decisions with healthcare. And I think that's kind of where things are slowly going.
Nice. I'm pronouncing you the employee benefits whisperer, Bill, from this point.
Okay.
And you just mentioned you've been in the industry for over 30 years. What keeps you hooked on employee benefits? The reason I ask that is because, once again, it's a subject that a lot of people just don't want to deal with because it's, like you said, complicated. What keeps you
It
hooked?
is.
And what was the moment you realized that this is something you're passionate about and you're also really good at?
Well, it took a while to get good at it. I mean, again, the market's changed so much from when I first got into the business. Pre ACA was a totally different world. Again, mainly, fully insured. We weren't doing a whole lot outside of the box. It was kind of like spreadsheeting, more of what I call a broker, product pusher, spreadsheeter. And that's kind of the extent of it. And then, it took me a while, but I slowly transitioned into being a consultant where, I really wanted to understand, what the business was trying to accomplish, and really wanted to be a business partner to add value to the company, not just the guy that gets judged on the increase that they bring once a year. I wanted my value to go beyond that. And I think the way you do that is to you align, you align the benefits with your business, your mission, your
Mm,
vision for the company, and you make the benefits, mirror that. And then when you have that conversation, again, it can take you all kinds of places. And I like being a problem solver for people. Um, I really see that as what I am. Usually when people are calling me, it's not because they just want to chat and say, "Hey, how's your day going?" It's usually like, "Hey, we got a problem." So, I'm the guy they come to and they want a problem solved. Or if they want to know, like, "Hey, I got this challenging increase, like, what can we do?" So that's the part I love. I like to to be the problem solver and the business partner.
Were those outside the box solutions the first couple times you started realizing that that could be a part of the business that hasn't been really uncovered yet? Were those conversations hard with some of those early business owners or businesses because they were so
Absolutely.
unusual?
Absolutely. A lot of times I'd show up at a company and, I would kind of go into my pitch about, wanting to understand more about your company, your business issues, challenges, you know, what's your vision for the benefits program. And I kind of go into my pitch. And then at the end of the conversation, they're kind of like, so are you going to get us a price? So and again, I don't fault anybody for that because
Sure.
for the last 25 years, we have conditioned the market to react that way. And that was their expectation of us is to, hey, bring us a price. We're going to pick the lowest price, best benefits for our employees and move forward. And unfortunately, we all realized, a few years ago that, hey, that's not sustainable. We can't do that anymore. We're at the, our box is full and it's about to explode because, again, at some point you have to address, chronic conditions, cancers,
Mm.
diabetes within your population. And if you don't do that, again, it's, you have to have a plan B to the traditional insurance market.
Mm. Yeah, that makes a lot of sense. I can see because I was that person because I remember you caught me. I'm moving you over. You caught me at like the perfect time when I was like, I want all this other stuff. Why is it in these plans? And then you guys came in and were like, hey, have you thought about doing this crazy stuff so you don't have to pay more money? You just kind of move some things around, free up some money you're already paying, and then be able to use that for things like the mental health program that we're now supplying to all
Yeah,
employees. And that was really important. So
absolutely.
follow the money. You've talked about the mattress money buried in RX industry and hospital administration. Can you break that down for us? Where's the money hiding, and how can companies take control of their benefits spending?
So again, a lot of the market in central Pennsylvania is very different than the other markets that in USI, especially the metropolitan areas, that they tend to be more fully insured driven. There's more competition. Out in central Pennsylvania, more companies are self-insured, whether you call that level funded or traditional spec and ag or through a consortium or a captive. You're either fully insured or self-funded. There's no in between.
Okay.
You can call it whatever you want, but there's been a lot of pressure, especially again, we've got some litigation out there where employer health sponsor or health plan sponsors are being sued because they are not being, I guess, responsible with their being the stewards or fiduciaries of their health plan. So employees of the company, current or former employees, have sued their employer for basically not doing their due diligence and you know bringing mainly a pharmacy program to the table that is affordable. And again, it has an adverse impact on wages and everything else. So
Sure.
that's kind of where that all came out of, that whole J&J lawsuit, which is in that material I had sent over. So that in itself, if you have a self-insured plan, it's governed by ERISA, where you are the fiduciary of that plan, which if you're self-funded, you are. That means that you should be doing something to at least try to unpack your pharmacy program. Because again, if you're relying on the carrier to bring that together, they own that contract. Most of the companies will never see it. And
Mm.
if that has exorbitant rates and fees and rebates built into the price, it can be very expensive. And again, the pharmaceutical industry is not regulated the way that other things are, so they can pretty much charge what they want. So from the time it gets from the drug manufacturer to your health plan, there's a lot of hands in the pot adding margin along the way. And again, we have pharmacy consultants internally that kind of get into the weeds, which again, I don't do that. I can speak to it at a high level, but we have pharmacy consultants that kind of dissect the plan, and they go in there and look at the definitions of a brand and a generic and specialty drugs, and they have a whole forensic analysis that they do, and they basically point out opportunities within that contract where you can, change the language or get the rebates coming to you instead of the pharmaceutical companies and even the carriers, or the PBMs, I should say, not the pharmaceutical companies. The pharmacy benefit managers obviously are taking some of that rebate.
Sure.
Sometimes the carriers are taking it. Sometimes brokers are taking some of that. So you really need to understand, like, where is that money? Who's getting, who has their hand out along the way, you know? And again, you want to get the lowest net cost for your employees at the end of the day, whether you're picking a vendor that puts the lowest net cost up front. We call that kind of a pass-through drug vendor. Or if you are going to retain the rebates yourself as the company, you at least have that money you can reinvest back into the plan, instead of just letting the PBMs and everyone else, have that profit. So, pharmacy again is the lowest hanging fruit, but again, there's other parts of that along the way. There can be claims that have excess monies that are attached to your claims, whether it be processing fees along the way. It's not just paying the bill; it's the bill plus any margin or administrative fees that get attached to that. So again, you want to be critical of the the administrative fees. You want to be critical of the stop loss. Do you have commissions in the stop loss? If so, why? It typically isn't smart financially to do that. So again, you could pull that commission out and get a reduction and just charge one all-in fee, and you can save money that way as well. So, you know, we go back to those four components again, where you really have to look at them independently and get as lean as you can with each one. And we kind of live by that principle.
Mm, that's really good. I think, yeah, I mean, you're dropping knowledge all over the place, and a lot of these people are going to go, oh my God, I got to look at my plan, hopefully, which is why we're here,
Yeah.
right? So, TPAs, you
Mm-hmm.
mentioned we have talked about third party administrators being a bit of a nightmare. What's the biggest mistake companies make when dealing with TPAs, and how can they avoid getting taken for a ride?
So, I mean, I like the TPA model because, again, it's historically it's been more transparent because a third party administrator doesn't typically have a horse in the race. So they're kind of contracted directly by the company. So they work for you. They're doing the basically all the insurance, blocking and tackling, from claims payment, customer service, billing, all those things, even coordinating the stop loss claims and all that. So everything an insurance company would do other than take the risk is
Okay.
really what the TPA would do. And there's a lot of good TPAs out there, but with the M&A, private equity, you know, out there's been a lot of TPAs that have been gobbled up, and kind of, ones that had been historically very strong all of a sudden either went away, or, they're not the same business model as they used to be. So it's been a challenge to really find good TPAs out there. And it's kind of like, if you find one, it's like, you hang on to it. But I do like the TPA model. It's, because it is kind of pulling the control and the power away from the carrier. And
Right.
again, nothing against the carriers, because, a lot of them do a great job at claims processing and administration, and they have, you know, good customer service and all that. It's just, again, if you're really looking to dissect your plan, finding a good TPA out there is critical. And then, make sure that you understand, what their business proposition is, and how are they going to manage your claims. It's one thing to pay a claim fast. I don't necessarily think that's a something that you should gauge a good TPA on, because again, if you're an employer and you just had a high claim, you want to make sure that you're paying that claim appropriately and at the right level, not necessarily getting the money to the provider in 10 days when that claim could have duplication, waste, fraud, abuse. You want to
Mm,
make sure that they're doing their due diligence, and they're kind of, pumping the brakes on that large claim and saying, wait, time out. We want to make sure that, we are paying this claim appropriately, and making sure the provider is giving us the detail that we need to make sure that we can audit this claim before we pay it. So I think, that's what you want to make sure you're looking at. You want to understand what their process is when a claim is received. and really have them articulate that to you, like what happens when you receive a claim to when it hits my email to fund on a weekly basis. You want to understand what that process looks like. And if there isn't a process, then that's probably a red flag. But
Hmm. I think you did mention when we spoke about there are some TPAs that work directly for the carriers, and that's one thing you want to watch out for because then they're working for the person that they may not be accountable, or they're accountable to the person that doesn't want them to be accountable.
yes, so again, it's all, you want to understand who your vendors are and who their interests are aligned with. So if it's not that it's a bad thing to go with a TPA that's owned by a carrier, because a lot of the big TPAs are owned by carriers now, the big four, the BUCAs, because we need them. We want their network access for our employees, they're critical in that piece. It's just that we want to make sure that there's no relationships there that they're kind of looking out for each other. So, and if
Mm.
there are, that's okay. We just want to make sure that we've got some kind of management in place to make sure that, the employer is benefiting from that relationship. So again, it can be, there's nothing wrong with going with a TPA owned by a carrier, even using a PBM that's associated with both of them. We just want to make sure that they're using our contract, not necessarily theirs, which is why, USI goes in and we've got contracts with all the big three PBMs to make sure that it's our language written by us, so we know what you're getting, as opposed to them just, again, packaging it and delivering it to you with no transparency into the contractual language.
That's brilliant. If you could expose one shady practice in the employee benefits world that most business owners don't even realize is happening, what would it be?
USI is big on transparency, which is, another reason I like working at USI. I mean, we're big on putting our cards out on the table. I think one thing that I really don't like, and I know it happens, is, brokers capitalizing on, a broken system, mainly
Mm.
pharmacy, where they're adding in fees, into the pharmacy program. So call it a per script fee. So, every time your employees utilize the pharmacy program, go to the pharmacy and have a script filled, there's programs where that's embedded into the plan, where the broker or consultant is getting a per script fee every time your employees are using the plan. And
Mm.
it's not always disclosed. It's like built into the pharmacy program. So that's one thing that, again, I don't like it. Now, if they're disclosing it and the group's okay with it, I don't know why they would be, but, you know, then I guess it's fair at that point. But again, it's pharmacy such a mess. We feel very strongly that that needs to be, very clear who's getting paid, where the rebates are going, all that up front, just, so they're not abusing that. That would probably be one of the big ones.
Mm. If you were starting fresh and had to redesign the employee benefits system from the ground up, what would it look like? What's broken right now, and how do we fix it?
Oh wow, that's a great question.
Loaded.
That's very loaded. I mean, we've again, it really starts with, again, I'm not a doctor. I act like I am sometimes, but I'm not at all a doctor. Um, but if you look at our healthcare industry right now, again, we're very good at treating somebody when they're sick or when they come down with something, you're having a heart attack, cancer, whatever it is. We are very great at reactive medicine. I think what's happened is, along the way, um, we there's just not much prevention in medicine, and I think everybody can kind of feel that when they go to the doctor. Historically, I don't think they taught a whole lot about nutrition and prevention and how to take care of yourself in med school. Again, that's what I hear. But now we're starting to see shortages in primary care. It's really hard to see your doctor unless you're very chronic and going to the doctor multiple times
Facts.
a year. A lot of times you're seeing a nurse practitioner, which, they do a good job as well, but, it's just not the same. There's just not an emphasis on prevention. Primary care is probably not very profitable to a lot of systems. So again, it's almost like in 10 years we'll go to urgent care as our primary care. So I just
Ooh.
think I see prevention and primary care kind of going the wrong direction.
Mhm.
So I really think it's up to the individual to be more informed about their own health and be better stewards of healthcare for themselves and their families, and kind of take the initiative to, you know, do the right thing. We have a simple program. We want employees to just go to the doctor, one way or the other. Get your screenings, get your blood work, know your numbers, and that's like half the battle. It's at least what you're dealing with at that point, and that prevention. You know, if you have a good analytics system, even that type of thing can be measured, because we know that the higher percentage of your population that's engaging with primary care, there's a correlation between that and your per employee per year cost. So if you get to 70% of your members are interacting with primary care, your per employee per year cost is going to go down. And that's something we can track and measure through time. It's a simple thing to measure. Everything else is kind of all over the place. But I just think, it's almost going back. We'd have to change the way that we access healthcare. I just think insurance and everything else is just a reaction to that. I don't think it's not the insurance carriers that necessarily created the mess. It's all of us together. Everybody that's a part of the healthcare industry has some responsibility for why things are the way they are today, and that's brokers included. It's whatever was easy at the time, we pushed it. And if it was the wrong thing, sometimes you'd say it was about making a sale or whatever, but it still is part of the problem. So I just think going back, it would just be changing the way the healthcare delivery system to focus more on prevention and how to take care of yourself so you don't get to those chronic levels. And I think I sent you some statistics on, we're chronically obese, which leads to the diabetes, the cancer, the heart disease. And that's really what's driving it. We're just, we are unhealthy as a population, and it's getting worse. If you look over the past 20 years, it's very sad how sick we've become as a nation. And, there's really nothing in sight to say, hey, this is going to get better, other than, we've got some advances with medications and things like that, but it really comes down to behavior and, taking care of yourself.
So, as a business, how can I help my employees with that preventative? Like, what's available? What, like, obviously, I'm huge on engagement word with the safety, quality, culture.
Right.
And to me, this is just another arm of that business culture that we can add
It
to
is.
proactive lifestyle. What is that
Right.
what does that scenario look like for you? Like, if you could mold it into anything, what would you do?
So I would definitely, again, a lot of it has to do with disruption. There's a lot of good ideas out there, but how do you put it in action without disrupting your employees to the point where, they feel like they're losing something, or you're putting it on them. They don't like that disruption. So, there's a lot of things you can do out there to incentivize primary care engagement. And I really think that's the key. How do we
Mm.
get people to the doctor so they can get those, preventive screenings, which are huge? That kind of talks about the preventive cancers, because we know it's a heck of a lot cheaper to treat things in the early stages than as opposed to the later stages. So again, that prevention, colonoscopies, prostate exams, mammographies, etc., all those preventive screenings. And you can kind of build your health plan to around that to kind of remove the financial barriers for them to get those things. So I think that goes a long way, because again, if you're like, hey, you've got a $5,000 deductible, now go get your lab work and your screenings, knowing that that's going to apply to a deductible, unless it's a true preventive service, which we know is that's another story. But it's not always preventive if you've ever had anything wrong at all. So it's
It's crazy.
that's something else that doesn't make sense to the consumer. Like, hey, I want to got a colonoscopy and I got a bill. Well, it's yeah, because it's not preventive when they find a polyp. That they don't understand. That's like a bait and switch. You go to you wake up from anesthesia and you have a bill and you're like, what happened? So that,
And not a good bill, not like a you bill. You
no,
got a bill.
you did get a bill. Um, so yeah, so there's a lot of things out there. You got the on-site clinics, you have near-site clinics, you've got virtual on-site clinics, you've just got the expansion of virtual benefits. And again, it really depends on your budget for wellness type programs. Is it even feasible to have an on-site clinic at a certain size? It might not be worth the financial investment. So, maybe there's employers in the area that are buying into a near site clinic. That's something that you can do, because again, you're incentivizing your employees to go get that primary care, where the healthcare system is kind of lacking in that right now.
Sure.
The problem is you're always going to have an employee that says, oh, well, I live too far, hey, I don't want to see a different doctor. Like, there's always going to be obstacles to that. So, I think that's the trick. Like, how do you put a program in place that's going to suit everybody's needs? So a lot of times we'll start with expansion of the virtual benefits, like we did with you, whether it's unlimited mental health, unlimited urgent care, dermatology, like the things that the healthcare system sometimes aren't providing the best service for, or the waits are too long, and that you can kind of use that as another option for your members to get that care without that barrier. I think that goes a long way, because again, you're providing that at a capitated rate, and those claims are not going to hit your claims run. So it's kind of like steering them to a lower cost center, and you can do that across the board. Orthopedics is another one. It's a high margin, high ticket item. That again, a lot of manufacturers, up to 20% of their overall spend can be musculoskeletal. So you got direct contract with one of the orthopedic hospitals. You can do that. That's a good way to save and to provide a benefit to your employees. You can basically say, hey, if you go to this provider for your orthopedic services, there'll be no out of pocket. And again, it's a way for them to get the care without giving them a financial incentive. And then again, the company's going to pay a lower cost for not going through the insurance for that. So that's another popular option that's out there.
Is there a mobile screening service? Like, if I got enough, like, obviously it'd be expensive for one company, but if I could get 5 or 6 local manufacturer industrial contractors, and we took a week, right, and this mobile screening just went from almost like a blood drive, right? Just went from spot to spot to spot in York and Lancaster County, and we all split the cost of that. Is that something that's actually feasible?
I mean, it is. I mean, it's definitely feasible. I mean, the healthcare systems offer it. There's third party vendors that offer that. The key to that is, you know, a lot of companies will do a health fair, and they'll do the finger prick, and they'll do the blood pressure, weight. They'll do the cholesterol and the sugar. That's fine, but again, if that's not getting to your doctor, and there's no follow up, then it's almost like it sounds good and it looks good to everybody, but is it really moving the needle?
Hmm.
Which is why we like to incentivize them to just get those things done. And you can put wellness programs in that kind of you know that says that, hey, we can give you a lower contribution to your health care if you go and get your routine blood work, your blood pressure, height, weight, and then you show that you're going to the doctor when you're supposed to. And for those people, at least they know their numbers. We know, again, it's a diagnostic test, not necessarily, a finger prick doesn't say what your A1C is, for example. So your sugar could be high that day, but it really doesn't. It's not deep enough. So you want to
Sure.
have those diagnostic tests that sometimes those fairs or those mobile screenings, they're just not able to do all that. So we still think it's better to just put a program in place, and you can do it with other employers. I mean, I just flew back from our annual captive meetings this week in Florida, and that was a big part of it. Like, the employers are trying to figure out, how can we do this easier, and together, to get people to pay attention to their health, and to actually partake in the preventative screenings and stuff like that. So it really is on top of everybody's mind at this point. And again, I'm not against the mobile screenings. It's just, how valuable are they, and what are you going to do with them once they're done?
Okay. So an incentive program to one, get your yearly physicals, do all your regular stuff seems to be the best course of action right now.
I believe it is because again, it's you're getting to the right place, getting the right care, and you're actually having diagnostic tests that are going to say, if you have these conditions, as opposed to just the finger pricks or the on sites. Because you might have an employee come and they have high blood pressure, and it's like, oh, you need to go to the doctor. So if they don't ever go,
It doesn't help.
which happens, it doesn't really help anything. So
Okay, that's good. Aha moment. What's one case study or success story where a company shaved a ridiculous amount of money or just a situation just by making a few key changes that their benefit strategy? Any real success stories that you're super happy with in your career?
yeah, I mean, we've had a lot of them. And again, it's they usually don't happen right away. I mean, a lot of the businesses that we end up doing business with, it's usually a 2 to 3 year process because again, they year one they have to know that you're not crazy, and then you come back the second year and it's kind of like, oh yeah, they said this would happen and it did, and then it's kind of like some are ready, some aren't, and then year three it's kind of like, man, I maybe they're right, but I think the success stories are, you know, changing a group's perspective, kind of like you guys. You were a good success story. Maybe not on the financial side because there's been much bigger numbers that we've been able to save. But, I just think getting an employer to, trust what you're saying and then start putting these solutions in action. And again, the savings doesn't always come year one. A lot of times it's, over a
Sure.
3 to 5 year period. But once you can really see that cost curve, we can really bend it and have an impact on it. And they can start to see that, hey, putting these strategies in place over time really work. It can really compound the savings. So, of course, larger organizations tend to save a lot more, but, there's several, case studies, a lot of manufacturing companies that, got a lot of traction with the what I call our incentivized physician engagement program. It might have taken 3 years, and then maybe year two or three, they roll it out to the spouses as well. And then it really gains traction. And you really have to hit the pocketbook with that too, to really get people to start to see like, hey, there's a financial, stipend for us to do this. And then you get the word of mouth, around the company, and you start, seeing people engage more over time. And then you can really, measure that through time, and you start seeing that it has an impact on your per employee per year cost. And that's definitely the biggest reward when we can see like, hey, we really stopped the hemorrhaging and we turned the ship around, and now you're at least sustainable now. And it's not easy. That's the problem. There's no easy button. If you come in and it sounds too good to be true, it's not. It takes work.
Yeah.
It takes commitment from the company. We all have to roll up our sleeves, and then we have to continue to work at it and then measure it year over year.
Yeah, I think it's one of those things as well. It's like culture, right? You never reach the pinnacle. You just keep continuously improving. Safety is the same thing. I think this health is always that, right? We just don't want to look at it the same way because it is hard work and it's stuff you have to put in. But we're asking for the least part of that is just get all your checkups done. Get ahead of anything that may be coming, right? And I'm not afraid of those conversations. I think we have a lot of trust in the company, which I think would make it. I actually feel way more confident talking about employee benefits now from talking to you, talking to Jeremy, just talking to Kathy, working through the process, looking at the reports monthly. Like that is giving me a lot of it. And so Molly and I go into those conversations. Just I feel way more armed, and I'm like, come at me, like this is why we're doing this is the next step, the 3 5 year plan. And I think it makes a big
Yeah.
difference. And you start talking a way more mature language than just like, well, I don't know, it's employee benefits. And it's more like, okay, what are we doing next, what are we tackling next? It seems to be making a big difference. So
No, that's great.
flip side of that, horror stories. Do you have anything that was this can't be real kind of moment in your career?
Wow. I'll tell you, compliance is one of those things where, you know, it kind of scares you. It's the liability. It's the, you know, we're not attorneys, but it's kind of fallen on the employee benefits
Mm.
broker to kind of be that compliance liaison. Even though, we're not accountants, we're not attorneys, we can't do the, filings and sign the paper, but we can do the preparation and we can, kind of guide the client along. But again, if they don't follow through or they don't do it, there's definitely some liability there that concerns us. Also, with things like Cobra, you have an employee that maybe you have a Cobra vendor that is kind of a third party, and something gets fallen through the cracks. Maybe you don't renew it right, or you switch brokers, and they were using their vendor and they shut it off, and you don't know. Someone goes out, was never offered, has a claim, and now you're liable. Things like that. Compliance is, there's a new one every year that you have to worry about. Um, but I would say, that's probably what keeps us up at night. The compliance aspect of the business and staying on top of that. And again, that takes a lot of work. I know that we have a program in place where we have the account managers work with our ERISA attorneys and our compliance team to do a compliance checklist for you guys to make sure that you're, checking the boxes. But again, there's just every time we come in to do a review, it's almost impossible to have everything buttoned up. So, that would probably be my biggest concern when it comes to this business.
Yeah, it makes sense. It's kind of like all the contracts we read for construction, right? It just gets so heavy a lot of the time, and everybody on both sides got to be so up with it. Lessons from 30 plus years. What do you feel is the biggest piece of misinformation you hear from employers to employees about their benefits? Do you run across something that's constantly comes up and you're like, that's not correct?
Yeah, I think a lot of times, just again, not everybody's an expert in benefits, and I think as a consumer, a lot of times you'll hear, employees or even employers say, oh, the health insurance company, they always want to blame somebody, and I know enough about it to say it's not any one entity's fault. Everybody has blame in the game when it comes to why we are where we are with this. It's not the insurance companies. It's not all the hospitals. They're all businesses trying to survive, and they all have different business models. So you just need to kind of understand that. And the more you understand the economics of healthcare and what everybody's role is and how they make money and who their true customer is, you kind of figure that out. But a lot of times you'll hear, oh yeah, the insurance company screwed me or whatever, and it's like, not really. But it's a lot more to it than that. The other thing is, a lot of times when we get service calls, they'll just assume that it was the insurance company that made the mistake, which I can tell you after we do our research and come back to the client, it's usually not. It's usually where they had the services, performed is where the mistake usually ends up.
Sure.
So that's another misconception that, who was at fault for the claim?
Hmm.
Well, I just got a battery notice in my ear.
Oh, you're good.
So,
Okay. Are you gonna have at least one ear left?
yeah.
um, Yeah, that's really good. I don't think I've made connections with the preventative versus reactive, but it makes a lot of sense. To me, that falls in line very much with the trades and not having enough people because college was pushed so hard for so many years and was funded through states and whatever that looked like. I don't even know the whole story, but like now we're eating the crow that we put in front of everyone for the last 25 years. And now it's like, oh my God, who's going to build all this stuff? And now we're in reactive
Right.
mode, right? It's very similar.
Absolutely.
Like we're all not healthy because we haven't been talking about it forever. And we also have food that's not good for us. That's in abundance, blah, 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 blah.
Absolutely. It's our lifestyle. It's, the processed food, the fast food, all those things kind of together, you know.
Yeah. I'm reading The Comfort Crisis right now. So I had a guy on a podcast last week and he told me to read The Comfort Crisis. And I'm only, I don't know, maybe 30% through it, but it's really about you should do something once a year that there's only two rules. One, you don't die, and two, 50% of the time you're not going to be able to finish it. So this
It's
guy
good.
goes and gets dropped into the middle of like the northern Alaska where you guys can only get in there by plane and blah blah blah. And they go caribou hunt with these two other people. One's like videotaping this guy who's a hunter, and then this guy's along for the ride because he's a friend. But like, if they kill a caribou, they have to walk the meat out like 100 miles to like get it out of the northern. Like they're not gonna get flown out. Like it's just something that you would never like expect that they'd be able to do. And so the guy who I had on my podcast, him and his brother carried a kettlebell, like a 40-pound kettlebell from DC to Annapolis, back and forth. They just switched. And he said, like, he got into the middle of the walk and, like, just laid on the side of the road because he was so beat. And his brother ended up carrying him for, like, 40 minutes during that span just so, like, they would make it. And now they're currently doing 1 million push-ups in their lifetime. And they've been doing it for 7 years, and they're at, like, 578,000 push-ups.
Wow.
So it's just doing, like,
It's
crazy
tiring.
stuff to get you out of your comfort zone. It's pretty wild.
Yeah.
We all need a bit more of that. So this question really is kind of from Jeremy. So hard to start and hard to stop. So he described you as an old diesel engine, hard to start but impossible to stop. So tell me, what gets you fired up in this industry? What's a topic that once you bring it up, you just won't stop talking about?
That's interesting that he said that. Okay. Is he trying to say I don't stop talking? I guess that's
No,
where he's
he's
going with
saying
that.
like once you get warmed up and you're hot about something, like watch out because Bill's on it. Bill's on a tirade, and he's really. But you just have a lot of passion for what you do.
I do. I mean, I get a little worked up when people don't believe me,
Ooh,
because I'm like, hey, I'm actually telling you the truth, and you know, you're taking it as, you know, that I'm just trying to sell you on something when actually I'm just trying to be honest. That gets me worked up when, and that happens.
yeah,
I
sure.
whenever it's like, hey, I get it. I was one of those years ago that kind of did the same thing because that's all I had available to me at the time. But with more resources and just being a better consultant, hey, there's a better way to do this, and just not getting that buy-in. I mean, I get a little bit worked up with that, but that and just healthcare in general gets me worked up. Just because it's such a mess, and you know,
No, that's really good. I think the passion is what sold us, right? Because once again, employee benefits is something a lot of people hate talking about, as I did as well. But when somebody comes in and like you clearly are sitting on our side of the fence, right? And just the way you communicated with that, and like, do you realize who's owning your money, right? You're coming from that angle of like, they're controlling all of it. Like, you're just handing over this chunk of change and then you're saying, okay, I believe you, right? And that's not great. And so, like, when you started breaking that stuff down and really talking to layman's terms, because, like you said, this is really confusing for people who don't live in this world. I still, there's huge parts of this whole thing that I just, it's like a circus to me. Um, and I'm assuming that's on purpose of why it's so confusing. So us layman people can't figure it out. But like that, getting fired up, being super passionate about what you really are into, and that being your job, I think is a huge selling point.
no, I appreciate that.
Yeah, loved it. Um, life beyond benefits. When you're not exposing hidden profits and employee benefits, what are you passionate about? What's something your clients would be shocked to learn about you?
Well, these days, outside of work, which isn't very much, I like to golf.
Okay.
So I'm a big golfer. That's kind of what I do to clear my head and get out there, with friends, family, and do that. Travel.
Mm-hmm.
We have kids that live different states and stuff like that, so we like to go visit them. I have grandkids that come over, so spend a lot of time with my grandsons.
Nice.
Um, so really inner circle people, family. I don't do a lot of going out and stuff like that. Probably should be exercising more, but that's a
Preventative,
whole
Bill.
nother. Huh?
Preventative,
It
Bill.
is. It is.
Um, what's your favorite place you ever traveled to?
That's a good question. Um, Love Mexico
Me too. We
for
just were there a
sure.
couple weeks ago.
Pacific side.
Mm.
Um,
Oh,
I
Pacific
like,
side. Okay.
yeah,
Okay. Haven't been over
not
there.
not Cancun or anything like that, but over on the Puerto Vallarta side. I like that.
Okay.
Probably that. There's places I would like to go um, that I haven't gone. Mainly, out west, Utah, Arizona are
Yep.
probably two that I'd like to go check out.
That's cool. Have you been to Canada at all?
Just Ontario had a steelhead fishing trip years ago that I went up to that was a lot of fun,
That's
but
good.
not deep into Canada.
Gotcha. Yeah, we went to Whistler in September and it was unbelievably beautiful. Well, before you run out of battery, we'll go ahead. That was all my questions, Bill. Is there
Okay.
anything that you want people to know about either yourself, USI, or anything the audience should know more than what we covered?
Um, I don't, I don't know. I just think I just think it's important to find a business partner, not just a
Well
broker,
said.
and try to understand the difference. You really need someone that aligns with your company, their values, their mission, and somebody that's like you said, truly on your side of the table. And it doesn't have to be us, but there's good consultants out there. You just have to know the difference and just know that, hey, they're not just a product pusher and a spreadsheeter. Really somebody that's going to be able to go the extra mile and roll their sleeves up and actually bring meaningful solutions to the table that can truly bend that cost curve for you and make a difference in the long run. Again, because if you don't, your employees are going to end up suffering. It's going to be the same old, same old. Hey, rates went up, deductibles went up, out of pocket went up. Sorry, guys, it is what it is. That's not acceptable anymore in today's age with the tools that we have available to us.
Yeah, I love that. I think the other thing USI brought forward is the data and the insight on the data for all of the metrics
Yes.
that are available. So don't
Yep.
settle for that not being available because it's all there. They
It's
can pull
there.
everything and they can
Yep.
tell you everything about it.
Yep. No, no, the days of historical data telling you what already happened, that doesn't help anybody. We've got the predictive data that can tell you what's going to happen. And
Yep.
there's a big difference.
Love
So
that.
it can be a lot of money.
Yes, love that. If anybody wants to get a hold of you, Bill, what's the best way to get a hold of you? Through LinkedIn? DM? Slide in your DMs?
Yeah. Yeah. LinkedIn's easy. I'm all over there.
Okay.
So my cell phone's on there, my email's on there. So
Awesome.
link me in, whatever you call it.
I love it. Well, Bill, thank you for coming on. I know
You
you're
bet.
not the
My
one who
pleasure.
actually signed you up here, but not everybody says yes, so thank you.
It's all good. It's my pleasure.
Awesome. Well, everybody, that is Bill Shoemaker from USI. If you want to get a hold of him, he's on LinkedIn. You can check him out, and we will catch everybody on the next episode. Thanks.